to speak for more than 15 minutes before we start. And our first speaker is Professor Oliver Findl from Austria, Vienna. And his topic is, what are the best options for protecting and hydrating the epithelium during surgical procedures?
Yeah, thank you, Leo, and thank you to CROMA for inviting me to speak. I want to start with a very sort of simple, if you want, topic, which is of relevance to us surgeons on a day-to-day basis. And that is essentially the problem that we typically have a nurse who needs to use BSS to flush the cornea so that we have good optical clarity during surgery. And the problem is that costs time for the nurses, and they have to sort of always think about doing that. And for the surgeon, it means also that once in a while the cornea gets a little dry and visibility gets worse. And so the idea here is how can we improve the situation for surgery? Now, I have some financial disclosures which I want to disclose. So the background essentially is that, as we said, the corneal surface needs to be wetted during surgery with corneal hydration. And this is typically done with BSS, or at least classically, and is additional work, and can also be irritating to the patient, because especially when on the patient under topical anesthesia, when the stream of BSS from the syringe is dropped onto the conjunctiva, the patient may experience some discomfort. And then with vitreoretinal surgery, where we use, for example, the biome system or some other indirect system to visualize the retina, we also need to have a wetting of the cornea, because otherwise, if you have to wet under the lens of the biome system becomes wet, and then you have to dry that again. So what we did in a trial was to compare a few different substances and their effect on corneal protection and corneal hydration. And what we looked at that time was, how long does it actually take if I put a viscoelastic substance on the cornea? How long does it take until I actually have clarity? I can see the lens, the iris. The second was, how long do I have corneal hydration until I actually have dry spots? And then also after surgery, if it's about surgery, what does the cornea look like? Was it protected and hydrated during surgery, or do the patients have a very dry eye situation with epithelial stippling postoperatively? So we started with an experimental trial on pig autopsy eyes, where we looked at different formulations of HPMC and hyaluronic acid. And then we had a trial where we actually did this under cataract surgery with patients. Then in that case, we already compared the two best substances from these experimental studies. And we also tested in healthy volunteers, because we wanted to look at some other factors which we couldn't look at during surgery. So just in short about the autopsy eyes, what we did here is we actually also took a Placido disc system, where the examiner could look through the Placido system, and I could actually just identify when there was clarity or regular corneal surface. And you can see that this optical clarity is typically reached with HPMC, so with methyl cellulose, is reached within seconds. But for hyaluronic acid, because of its viscosity and its properties, its viscoelastic properties, it does take quite a little longer until you actually have a nice regular surface and therefore good visibility. And then the other factor is the duration of the corneal hydration. And here you can see this is in seconds, so that's a little irritating, because obviously, but you can see that the hydration will stay 10 minutes and longer with HPMC, but significantly longer with hyaluronic acid. So in that case, for example, for vitreoretinal surgery, we thought that probably a hyaluronic acid substitute would be better. And here you can actually see now in the subjects with the lid speculum in place, but not under surgical conditions, and now looking at the grade of corneal stippling after surgery, that with BSS it's pretty high, and less so with hyaluronic acid, and HPMC somewhere in between. And here, from the cataract surgery patients now, you can see that there's a lot of corneal stippling with the BSS patients after surgery, because there seems to be a dry situation on and on during surgery, because obviously the nurse wasn't able to flush enough. And with hyaluronic acid, that was actually significantly better, and HPMC, again, sort of in between. So the conclusion from these first experiments for us was that these two substances, HPMC and hyaluronic acid, in general, lead to a better protection of the cornea than BSS when used during surgery, and that HPMC is a substance which will dissipate very quickly, meaning giving you optical clarity very rapidly, however not for such a long time. So we thought this is probably good for cataract surgery, which typically does not last too long. But if you have extended surgery like vitreoretinal surgery where you want optical clarity, but you don't need to have the optical clarity immediately because you still have time to prepare, for example, the biome, that hyaluronic acid in 1.5% concentration was better and more effective. So what we did now is CROMA actually came up with a preparation for anterior segment surgery, especially. You can obviously also use it for vitreoretinal surgery, but you may have to rehydrate at some point. And we did a randomized, controlled, subject and examiner-masked study with cataract patients and cataract surgery, looking at the efficacy of this HPMC 2% compared to BSS. And we looked at patient comfort, discomfort, and especially optical clarity during surgery. And here you can actually see the optical clarity. This is 101 eyes of 97 patients we included in this randomized trial. These are the two groups. And we rated optical clarity. This is the surgeon who rated 1 as being very good and 5 as being very poor. And you can see that the BSS is slightly worse than the HPMC, where there seems to be, this is the median range. Median, you obviously have a range here, having better clarity and essentially having only to use it once. And BSS in these operations had to be instilled 10 times in median. So that showed for us the application frequency and optical clarity that the HPMC had significant advantages over BSS+. So essentially you need few applications and it provides you a longer prevention from drying of the cornea and a better optical clarity during surgery. And that essentially will subsumize what we've said already. This is the actual product. It's called Cornea Protect. That's the one we used in this randomized trial. So it's a single-dose unit in this special unit plastic filling. You open the lid. You can actually reinstitute the lid if you want to. Typically what we do is we will instill a few drops. This can either be done by the nurse or the surgeon, however you prefer. And then we put it on our tray where we have the rubber endings of, the typically blue or green tray where you have the instruments, and we just stick it on there so that it's actually in this position during surgery, that should you need to instill some more drops later during surgery, you don't get any air bubbles or any problems of that kind. It can be stored on the room temperature, so it's quite convenient, and this is actually the way it's being applied. And with that, I just wanted to leave you. So this is something we're using on a routine basis now, and actually we're very happy with it, and most of the surgeons don't want to miss it anymore. Thank you.